Hi, my name is Kathryn Gorkowski, and here's my rubric for the 2025 head to toe. Page 1, front and back. Page 2, front and back. Page 3, front and back. I'm just going to set that off to the side here. Hello, my name is Kathryn, and I'm going to be your student nurse today from Saginaw Valley State University. Can I please get your name and date of birth?
Sarah Howard, April 28, 2006.
Okay, and do you know where we are currently?
Yes, Saginaw.
Okay, and can you tell me the year?
2025.
Great. So you are A&O times 3, so I feel comfortable going ahead with this assessment today. Today I'm going to be doing a head to toe assessment on you. So starting from your head all the way to your toes, front to back. Is that all right with you?
Yes.
Okay. Before we begin, I'm just going to do a brief health history on you. Can you tell me what your diet consists of? About how many times a day do you eat, and usually what do you eat?
I eat 2 to 3 times a day. I eat a lot of vegetables for my lunch and dinner, and protein and carbohydrates.
Oh, good. Okay, so a very well-rounded diet. You feel like you're getting enough food in then?
Mm-hmm.
And how's your hydration? Is pretty good then? Good. Next, can you tell me, are you allergic to anything?
Nope.
No allergies? Okay. Can you tell me how many times you exercise?
About 2 to 3 times a week.
Okay. And about how long?
An hour to an hour and a half.
Okay, very good. And typically what do you do? Do you run,
Walk and play volleyball.
Okay, nice. Do you have any, do you take any medications?
No.
No herbals, supplements, anything like that? No. Okay. Do you have any current or past medical history that I should know about? Any past surgeries?
I had ear surgery.
Okay. Any complications with that surgery?
No.
Okay. And do you have any family history?
No.
Okay. Can you tell me, do you smoke or use tobacco products?
No.
Okay. And do you drink any alcohol?
No.
Okay, sounds good. So before we begin, I'm going to do a quick set of vitals on you now. So just your pulse, your blood pressure, temperature, all those good things, okay? Can you tell me, on a scale of 0 to 10, are you currently experiencing any pain?
No. No pain, so 0.
Okay, sounds good. I'm going to come around to your left arm here. I'm just going to feel for your brachial pulse. Feel it there. I'm just going to feel a slight squeeze when I start puffing up that cuff. (104/78). Pretty good blood pressure. Is that normally around your range?
Yeah.
Okay. Next thing that I'm going to do is I'm going to take your radial pulse now. So if you want to see your hand. so your pulse was 70 and your respirations were 16, so both are within range. Next, I'm going to just take your tympanic temperature now. So I'm just pulling up and back. 98.9, so that's normal. And since I don't have a pulse oximeter, I'm just going to assess your nails for any clubbing. So I'm going to have you move your hands this way. Very pretty nails. I don't see any clubbing in your hands to be concerned about. And since I'm here, we're just going to check capillary refill as well. And since you do have your nails done, I'm just going to do it at the bottom of your fingertips. That capillary refill is coming back within 3 seconds, less than 3 seconds, which is what we want to see. So I'm not worried about any oxygen abnormalities. The next thing that I'm going to do, so I'm going to start my assessment now, and I'm just going to start on your arms and your hands first, okay? I'm just going to check your arm, just inspecting it, not seeing any abnormalities, maybe just a little scar there. Oh, another little scar there. Does that give you any troubles at all?
Nope.
What did you get that from?
An air conditioning unit.
Oh, it fell on your hand? Mm-hmm. Yeah, just a little scrape there. All right. Next, I'm going to assess muscle tone. And your muscle tone seems very symmetrical, very strong. The next thing I'm going to do is I'm going to assess your radial and brachial pulses. So I can have you flip your hands up. First here is your radial pulse. Both symmetrical and strong. And your brachial pulse. Both symmetrical and strong. Very nice. The next thing that I'm going to do is I'm going to do a range of motion test on you. So can you just move your hands like you're swimming for me? Move your arms. Good. So just like cracking in there. Is that normal for you?
Yeah.
All right. And next, can you rotate your hands for me? You hear just a little bit of cracking in there. Is that normal again for you?
Yeah.
All right. Do you do any sports then?
Mm-hmm.
Yeah. Okay. Play that volleyball. Yeah. Next, can you, when I try and push your hands in, you're going to try and push them out, okay? So go ahead and push out. And then when I push out, you're going to push my hands in. Good. And then can you push my hands down? And then push my hands up. Very good. Nice and strong. The next thing that I'm going to do is I'm just going to have a look at your face, your hair, and your neck next. So can you take your hair out for me, please? Very good. So first I'm just going to look over your face. I'm just seeing a little bit of acne, but other than that, it looks pretty good. Very symmetrical. And then the temperature also feels nice and warm. Next, I'm just going to have a look in your hair now. Not seeing any dryness, no abnormalities or anything like that. Just looking at the nape of the neck. Again, not seeing or feeling any abnormalities there. The next thing that I'm going to do is I'm going to just palpate your lymph nodes now. Let me know if you feel any pain or tenderness. Occipital, postauricular, preauricular, submandibular, submental, cervical chain. Can I have you hunch forward for me with your arms? And this is supraclavicular. And since I'm here, I'm just going to also assess for tissue turgor. And I don't see any tenting, so that means you're well hydrated. I also didn't feel any of your lymph nodes either. No inflammation there, which is good. Next, I'm just going to palpate your sinuses now. So your frontal sinuses. Any pain or tenderness?
No.
And your maxillary sinus. Any pain or tenderness?
No.
Alrighty. Next, I'm just going to palpate your ears now. So just, I see you have some earrings here. Do those ever give you any troubles?
No.
Good. And I'm just going to have a peek inside into the external ear canal as well. So I'm just going to pull the ear up and back. Not seeing any redness, no abnormalities there. Again, up and back. Again, no redness or anything to be concerned about there. The next thing that I'm going to do is I'm just going to look in your nose now as well. So just gonna take a peek in here. I'm not seeing any deviated septum, any redness or anything like that. Again, you said no allergies, correct? Nope. Any trouble breathing?
Nope.
Can you pull up one side of your nose and then breathe normally? And then the other side? Any worries for that? You can breathe normally?
Yeah.
Okay, good. The next thing I'm going to do is I'm just gonna assess your mouth now. So just looking at the outside, I can see that your lips aren't dry, nothing to be too concerned about there. Can you open your mouth for me? Your oral mucosa is looking good, your teeth look nice, nothing to be too concerned about there either. When was the last time you've been to the dentist?
Last month.
Last month? Okay, perfect, great. No worries then with your teeth or anything like that, no cavities?
Nope.
Okay, good. Now I'm going to assess cranial nerves number 9 and 10, which is your glossopharyngeal and your vagus nerve. So can you open up your mouth for me and stick out your tongue? And say ah?
Ah.
Good. So everything in there looked good. I was watching for that rise in the soft palate, and I saw that, and also with the uvula. And your tonsils didn't look inflamed or anything like that whatsoever, which is good. Next, I'm going to assess cranial nerve number 12, which is your hypoglossal nerve. Can you stick out your tongue for me? And then wiggle it side to side. Very good. So that nerve seems to be intact. Nice movement there. Next, I'm going to assess cranial nerve number 8, which is your vestibulocochlear nerve. You can hear me okay, right? No muffled noises or anything like that?
Nope.
Okay, good. Next, I'm going to assess your olfactory nerve, which is cranial nerve number 1. So I'm going to put this powder under your nose with your eyes closed. Can you tell me what you smell? Eyes closed.
Onion powder.
Very good. It was onion powder. Very strong too. Next, I'm going to assess cranial nerve number 5, which is your trigeminal nerve. So can you clench your mouth for me and then open, and then clench it back shut? Very nice. Next, I'm going to assess the sensory function of that of cranial nerve number 5, which is your trigeminal nerve. So I'm just going to place a Q-tip around your face, and just tell me where I have my Q-tip placed. Okay? So eyes closed.
Forehead. Right cheek, left cheek, chin, nose.
Very good. So you got all of those, which is lovely. Next, I'm going to assess cranial nerve number 7, which is your facial nerve. Can you puff out your cheeks for me? And then raise your eyebrows. Good. And then can you smile? Good. And then frown. Very good. So that cranial nerve number 7 seems to be intact. Next, I'm going to assess cranial nerve number 11, which is your accessory muscle nerve. I can tell that you're not using it to breathe right now, but I'm just going to make sure it's intact. Can you shrug your shoulders for me? Good. So cranial nerve number 11 is intact. Next, I'm going to just assess your eyes now. Do you have any sensitivity to light?
No.
When was the last time you went to the eye doctor?
Last summer.
Last summer, okay. And do you have any prescription eyeglasses, any contacts?
Glasses.
Okay, you have glasses. Any worries or any issues with those?
No.
Okay, alrighty, good. So the first thing I'm going to do is I'm just going to look for pupil constriction now. And so I'm just going to bring this down your nose, and I can see pupil constriction. Left eye, right eye. Both constrict with light, which is good. Next, I'm going to assess the accommodation factor of your eyes. So I'm going to have you look at my pen light and then back at my hand. Back at my pen light and then to my hand. Good, so they dilate with my hand and then constrict to my pen light, so they're accommodating. So your eyes or what we call perla, which your pupils are equal, round, reactive to light, and accommodating, and that was assessing cranial nerve number 3, which is your ocular motor nerve. Next, I'm going to assess cranial nerves number 3, 4, and 6, which are ocular motor, your trochlear, and your abducens nerve. So I'm going to move my pen light in 6 different directions. This is called the 6 cardinal fields of gaze, and I want you just to follow with your eyes alone, okay? Very good. So your eyes followed in all those directions, so I don't have any worry or concern with that. The next thing I'm going to do is I am going to assess your eyes once more. I'm just going to pull down on your eyelids here, and can you look up for me? Good. And then can you look down? Great. So your sclera is nice and white, and your conjunctiva are nice and pink, which is good. Next thing I'm going to do is I'm going to do a cerebellar function test on you now. So can you make an OK sign for me? And then touch each finger to your thumb. And go as fast as you can with that. Good job. And then can you put your hands on your lap facing down, and then bring them up and then back down, and do that as fast as you can. Good. And the next thing I'm going to do that's part of that test is I'm going to have you touch your nose and then touch my pen light, and I'm going to be moving my pen light around, okay? So nose, pen light. Very good job. Alrighty. The next thing that I'm going to do is I'm just going to listen to your carotid pulse now. I'm just going to listen with the bell of my stethoscope, listening for any bruise, which is abnormal blood flow. And go ahead and hold your breath. And breathe normal. And go ahead and hold your breath. And release. I didn't hear any bruise or abnormal blood flow when I listened. Now I'm just going to palpate once more with those carotid pulses. I wouldn't want to do this at the same time because that would mean lack of blood flow going to your head, and I wouldn't want you to pass out here right now. So the next thing I'm going to do is I'm going to assess your thyroid now. So I'm going to move on to the to your back side, and I'm just going to assess your thyroid, okay? Okay. You want to put your hair up for me? Thank you very much. Alrighty, so I'm just first starting at the top, and I'm finding that cricoid cartilage, and then I'm just going to displace your trachea. And can you swallow for me? Very good. And then the other side, swallow. Good. So your thyroid is not enlarged, nothing to be concerned about there. Before I proceed, I'm going to check over my rubric one time for less than 30 seconds, just making sure I got everything. And I believe I got everything, but I am going to palpate your sinuses as well, just in case I didn't before. So this is your frontal, and then maxillary. Any pain or tenderness with that? No. Alright, sounds good. I'm going to now move on to your backside now, and I'm going to listen to your lungs. Now this can be a little bit strenuous, so if you get tired at all, just let me know, raise your hand or something to let me know that you are tired and we can take a break. I'm I'm first going to inspect your back here. Just seeing a little bit of acne, nothing to be too concerned about. Your temperature feels nice, and the spine looks to be in alignment. Nothing to be too concerned about there. Next, I'm going to assess your AP ratio. So it looks like you are a 2-to-1 AP ratio, so no barrel chest there. Next, I'm going to see if where the lobes of your lungs are. So can you take a deep breath in and out? Deep breath in and out. Another deep breath in and out. So the ends of your lower lobes are about right here, so that's where I'm going to stop my assessment. Now, can you bring your shoulders back for me so I can see that scapula? So your scapula are about right here, and this is about where they end right here. Okay, you could go ahead and relax your arms down, keep them on the front, on your lap. Now I'm going to listen to your lungs in about 12 different spots. So again, if you get tired at all, just let me know and we can take a pause. Every time I move my stethoscope, just take a deep breath in and out, okay? Go ahead. Just gonna move your brow up. Very good. So I heard clear in your lungs, which is what we want to hear. Next, I'm just going to percuss your lungs now. So I'm just going to tap here. And I heard resonance, which is very good, so that's what we want to hear. The next thing that I'm going to do is I'm just going to have you lay down on this bed here now. Alright, so next I'm just going to take your pillow away for just a little bit. I'll place it back, but then can you lay flat there for me? And then can you turn your head to your right, please? And then to your left. I'm just checking for jugular vein distension or JVD, and I don't see any present. You can go ahead and lift your head back up now. If I did see any JVD, I would raise the head of bed to 45 degrees, and if I still saw it, then I would be worried about fluid overload, but I don't have any concern right now. Do you mind if I pull your gown down now?
Yeah.
Next, I'm going to begin with the cardiovascular portion of this assessment. So I'm just going to listen to your heart valves now. And if at any moment you feel uncomfortable, just let me know, okay?
Okay.
So I'm going to find your, first going to find your aortic valve. So that is, I see your clavicle, rib 1, intercostal space 1, rib 2, intercostal space 2. It's right here. And I'm going to listen with my diaphragm. This is your aortic valve. And then I'm going to listen with the bell. And I don't hear any bruits or any abnormalities there. I did hear that lub-dub, which is what we want to hear. Next, I'm going to move on to your pulmonary valve. So I see here clavicle, rib 1, intercostal space 1, rib 2, intercostal space 2 right here. First, listen with my diaphragm. With my bell. And I did hear that lub-dub and no bruits or murmurs or anything like that. Next, I'm going to move on to Erb's point. So this is rib 3, intercostal space 3. And I heard lub-dub and no murmurs. Rib 3, or intercostal space 3. Rib 4, intercostal space 4. Here. My stethoscope is right there. This is your tricuspid valve. Hearing that lub-dub. Ooh, stuck there.
You can roll it if you need to.
And no murmurs there. Now I'm going to find intercostal space 5, which is your mitral valve. But since I did have a little difficulty there, I'm just going to reassess. Clavicle, rib 1, intercostal space 1, rib 2, intercostal space 2, rib 3, intercostal space 3, rib 4, intercostal space 4, rib 5, intercostal space 5. And I'm going to come to mid-clavicular line here. It's right here. Oop, I'm sorry.
You're good. Didn't hit me.
Oh, okay, good. Alrighty, I'm gonna listen to with my diaphragm. And this is your mitral valve. And I'm going to listen to your apical pulse for 1 minute. Alrighty, so I got 67 for your apical pulse. Next, I'm going to listen with the bell of my stethoscope. And I don't hear any bruits or murmurs there. Next, I'm going to move on to the abdominal portion of this assessment. So I'm first going to auscultate your abdominal artery, your iliac artery, and your renal arteries. But first, I'm just going to inspect. Feeling very lightly, your temperature feels good. I don't see any abnormalities or any lesions. Just getting to your side of the bed, and I'm just checking for that pulsation of the abdominal artery. Good. And then I'm just looking at the foot of the bed now. And I do see it there. Next, I'm just going to auscultate now with the bell of my stethoscope. So I'm first going to find your xiphoid process. About right here. And then your umbilicus and in the center. About right here. Making sure I'm not pressing hard or anything like that. And I don't hear any murmurs. Next, I'm going to move on to your left renal artery. Right renal artery. I'm just going to pull your shorts down just a little bit here. And I'm going to go down to that iliac artery. And iliac artery on your left side. And I didn't hear any bruise and I didn't hear anything at all, which is very good. Next, I'm going to auscultate and listen to your bowel sounds now. So again, I'm just going to pull your shorts down just a little bit more, a little further. Now, I'm going to listen for at least 5 bowel sounds in all 4 quadrants, okay? So starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. So your bowel sounds were active times 4, so I heard at least 5 bowel sounds in all 4 quadrants, which is good. Next, I'm going to percuss your abdomen now. So I'm just going to start in the right lower quadrant. And I heard tympani, which is what we want to hear. Any pain or tenderness so far?
No.
All right, next I'm going to start in the right lower quadrant, and I'm going to find your liver border. So I start to hear a dullness about right here. So that would be your liver border there. Next I'm going to move into light palpation now. Just let me know if at any moment you feel any pain or tenderness.
Okay.
Not feeling anything, and the patient is not showing any signs of pain or anything like that. Next I'm going to move into deep palpation now, starting in the right lower quadrant. Any pain or tenderness?
Nope.
Okay, very good. And I didn't feel any abnormalities. Next thing I'm going to do, since we're here, is I'm just going to feel for your femoral pulse. Now your femoral pulse is in the groin region, so if at any moment you're uncomfortable, just let me know, okay?
Okay.
And I'm just going to pull this down here. So I'm first going to feel for the femoral pulse. If you want to frog your legs out for me, just a little bit.
Froggy.
Yeah, that's perfect. Okay, and I feel your femoral pulse. My fingers are right here. And I'm going to move on to the other side. And I feel your femoral pulse and my fingers are right here. Next, I'm just going to check for symmetry on those. And they are both strong and symmetrical. Next, I'm just going to auscultate and listen with my stethoscope with the bell of my stethoscope for any bruits. My stethoscope's right here. And I didn't hear anything, which is good. No bruits or anything of that sort. So you can go ahead and put your gown back on if you like. There we go. And I'm going to have you keep laying down though for a little bit. So next I'm going to assess your legs now. So I'm not currently seeing any abnormalities here. Everything looks super, super good. Kneecaps are just a little bit dry, not too bad. Everything is very symmetrical. Next, I'm going to have you just pick up your legs a little bit for me. There you go. And I'm just going to feel your pulse here. There's that popliteal pulse. Next, I'm going to assess your posterior tibialis pulse, and your pulse was very symmetrical on both sides. Posterior tibialis pulse. Present and symmetrical on both sides. Do you mind if I take off your socks?
Sure.
Alrighty. Next thing I'm going to do is I'm just going to assess your dorsalis pedis pulse. and it's symmetrical and present on both sides as well. The next thing that I'm going to do is I'm just going to look also at your feet as well for any lesions, abnormalities, any pressure sores. I see you do have a tattoo here. Any issues with that tattoo? No. All right, and I'm not seeing any pressure sores. I'm just gonna have a peek in your toes. Not seeing any athlete's foot or anything to be concerned about. Next, I'm just going to check capillary refill on your feet. And that capillary refill is coming in less than 3 seconds, so I'm not worried about any oxygenation or perfusion issues with that. I also don't notice any clubbing or anything on your toes either. The next thing that I'm going to have you do is I'm going to just have you sit up on the side of the bed for me, please. I'm going to come around to this side. And I'm just going to check your patellar reflex. So right below your knee, just close your eyes for me. A little bit lower. Reflex doesn't want to go for me. Check this side. Oh, a little jump there. Not so much on this side though. There we go. How about this side though? There we go. Alrighty, got that patellar reflex after all. Just took a little bit of work. Just gonna tie up your gown here while I'm at it. And really quickly, I'm just gonna check for tissue turgor since I'm here, if I did not do that already. Your tissue turgor is good, no tenting whatsoever, so your hydration is very good. Next, I'm going to put on your socks and shoes. Any dizziness at this moment in time?
No.
Okay. And before I put on your socks and shoes, I'm just going to do a quick sensory test on you right now. So can you lay back down on your bed for me? Yep. Perfect. Now, for reference, I'm going to do a sharp and dull test on you. So for reference, this is dull.
Okay.
And this is sharp. Can you tell the difference between the two?
Yeah.
Okay, good. Now, I want you to tell me whether it's sharp or dull, and I want you to tell me which leg, which foot, and in what area. So thigh, knee, calf, etc. Okay?
Okay.
Alrighty, go ahead and close your eyes.
Sharp on my thigh.
Which side?
Oh, my right.
Okay.
Dull on my left thigh. Dull on my right knee. Sharp on my left my left shin.
Hey.
Sorry.
Oh, you're okay.
Sharp on my right shin. Dull on my left knee. Dull on my right foot.
Top or bottom?
Top. Dull on my left foot.
Top or bottom?
Top. Dull on my left bottom foot. Dull on the right bottom foot.
Very good. You got all of those. So.
Tickled.
Yes, it does tickle. Yes, so you got all of those, which is great. The next thing, you can go ahead and sit up now for me. Thank you very much. The next thing that I'm going to do is I'm just going to do a strength and range of motion test on your legs quick. So when I try and push your feet in, you're going to try and bring them out against my hands, okay? Go ahead and push out. Go ahead and push in. When I try and pull them out, you're going to bring your legs back in, okay? Go ahead and bring them in. And go ahead and try and push out. Good. With your feet, when I try and bring them up, you're going to push them down, okay? Good. And then opposite. Very good. Can you also roll your ankles for me? Any cracking or anything like that? Just a little bit? Is that normal for you? Okay. All right. The next thing I'm going to do is I'm going to put on your shoes here. Are you busy at this current time?
Nope.
Go go ahead and push down. There we go. Got her eventually. What's going on with this shoelace? There we go. I'm just going to tie up your shoes here. Go ahead and push down. Very good. Does that feel pretty comfortable?
Yeah. Yeah, there it goes.
Okay. Alrighty. So, just to explain to you a little bit before we get started, I'm going to have you stand up with your legs shoulder width apart, hands at side, just to check your balance to see before we begin walking. Okay, so can you stand up for me? Very good. I'm just going to tie your bottom portion of this gown here. Here, I'll sit. And then, so can you put your feet shoulder width apart, hands at side, and I'm not going to push you or anything, I'm just going to be here in case you fall or get unsteady. So close your eyes, and we're going to close our eyes for 10 seconds. You are. Alrighty, so I only saw very minimal swaying, so you have a negative Romberg test, which is good, so I feel comfortable walking you. So we're going to walk this way for 5 steps, and you're just going to walk normal, okay?
Yeah.
Just walk straight ahead for me. And turn around. And then on our way back, we're going to walk heel to toe, okay? And bring that foot. Yep, you're good, you're good. There you go. Very good job. So you can go ahead and have a seat now. I'm just going to check over my rubric one last time, but before I do that, I'm just going to give you a Braden scale score now. So Braden scale score ranges from 6 to 23. It's just your risk for developing a pressure ulcer. Based on the things we discussed today, your activity, your mobility, I should say, your nutrition, you're not incontinent of any urine or stool or anything like that. I would give you a Braden scale score of 23 out of 23, so 0 risk for developing a pressure sore right now. I'm just going to check over my rubric one last time. Okay. I believe that I have assessed everything today. Do you have any questions for me?
No.
Okay. Thank you very much.